Hey everyone, my name's Mark. I'm one of the cardiology fellows. Spencer is another cardiology fellow who's behind the camera. Today we're going to go through just demonstrating keys to image acquisition of a point of care ultrasound of the heart. We're going to use this dummy here, and I'll just walk you through some of the basic views and how to kind of optimize them for whatever you need to do. And Spencer will ask me questions as we go. Okay, so we're going to start in the parasternal long axis. So one thing to keep in mind is that all of your transducers have this, what's called an indicator. Sometimes it's a bar, sometimes it's just a little dot at the end of the probe. This indicator corresponds to the dot that is on your ultrasound screen, so you know that that is the same side as where your indicator is. So it's one thing to keep in mind when you're starting to acquire your images. So as I said, we'll start with the parasternal long view. So that just means we put the indicator probe on the patient's chest. It's the left parasternal space, and you want the indicator pointed towards the patient's right shoulder. It's about the third or fourth intercostal space. So I put my indicator probe on, and what you can see on the screen is it's all just black. That's pretty common. That's basically a consequence of what we call rib shadowing. So that just means that the probe is right over a rib and we can't see anything behind the rib. So all that I do to fix that is I slide the probe up or down. So I'm going to slide the probe this way, and we can see if that fixes the image quality at all. So you start to see something come into view. So there we have a heart, and that's a pretty good view of the parasternal long axis. But what I'm going to do is I'm going to tweak it just a little bit, because you can see this is the left ventricle here, and I'm a little bit off axis. So what I'm going to do is I'm going to twist. I'm going to keep the same position, but I'm going to twist the probe so that the indicator points a little bit more towards the right shoulder, and we'll see if that fixes the image at all. Looks a little bit better now.
What do you mean by looks better?
So one thing is that the different, what I can see as far as the left ventricle, and the mitral valve and the aortic valve, the leaflets are a little bit crisper, and I can see their motion a little bit clearer. The other thing is that I'm going to turn it back to where it was before. There was still a little bit of rib shadowing there in the other one, and do you see the left ventricle here? It's not really fully, we call this foreshortened. This just means that I'm kind of cutting, maybe you can see here better. I'm cutting through the left ventricle so that I can't really see the whole thing. If I twist it to elongate the whole ventricle, I can see it a little bit better. And you can almost see, from this view you can't see the apex, but you can see more of the left ventricle here. The other things to keep in mind are the depth. So I'm going to switch hands here. The depth here is actually pretty good. You want to make sure that you can see the entire posterior wall of the left ventricle, the posterior wall of the left atrium. This is the descending thoracic aorta here. It'd be nice to see maybe a little bit more of this. So on these machines, you just click on the depth, and I can drag this up or down, so that makes it zoom in more. This makes it zoom in less. That's probably a reasonable view. When you have the actual ultrasound machines, it's just a knob that we'll show you on a separate video. And then the other thing to keep in mind is your gain or your contrast. And so really what you want to do here is you just want to optimize it so that you can actually see the structures of interest best. So you can adjust, this is the gain, and this is the contrast. If you have it way up like this, it's almost too bright. There's too much contrast and there's too much gain, so it's almost distracting from what you're actually looking at. Where we had it initially was probably reasonable, but I think just knowing that these are things that you can tweak and adjust is useful. You kind of know what's comfortable for your eyes to look at.
There is a function called auto gain or optimization that most of the machines have that you can use to get optimization based on the computer algorithm.
You just press the button and it makes it look a lot better. Okay, anything else before we go to parasternal?
Show us the structures.
Yeah, sorry. So this is your basic parasternal long axis view. This is where we almost always start because it gives us a really nice outline of a lot of the different structures of the heart. So this here is the left atrium. I'll use the mouse. These leaflets here are the leaflets of the mitral valve. This is the anterior leaflet, posterior leaflet. This is the left ventricle. Oftentimes we'll see these little things in the left ventricle that you're not really sure what they are. This is a papillary muscle. We'll see that a little bit better in the short axis views. So that's attached to these mitral valve leaflets. We just can't see all the structure because it's out of the plane of the ultrasound. And then this valve obviously then is the aortic valve, and then this is the aorta coming up here. This structure that's on top is the most anterior chamber of the heart, remember, because this is the ultrasound beam coming from the top. This is the chest wall of the patient. So the thing that's closest to the ultrasound is the most anterior chamber, so that's the right ventricle of the heart. So you have right ventricle, left atrium, mitral valve, left ventricle, aortic valve, aorta. This is the posterior wall of the heart. This is the descending thoracic aorta. This patient, in this view at least, doesn't have a pericardial effusion, which we would see as fluid collecting posteriorly. It would collect between the heart and the descending aorta.
And fluid is black.
Fluid is black, yeah, thank you. And a pleural effusion, you could also see sometimes in these views, that also collects posterior to the heart, but it would be posterior to the aorta here, as opposed to a pericardial effusion, which is between the heart and the aorta.
So that's why Mark earlier had changed the depth to be able to see the aorta, which can help with the pericardial effusion versus pleural effusion question.
Exactly. Okay, anything else before we switch here?
Nope.
Okay, great. So we're in parasternal long view now, so now I'm going to switch to the parasternal short view. So all that we're doing is we're going to rotate the probe about 90 degrees. So now we're going to start to cut the heart in the short axis view like a loaf of bread. So I'm keeping the exact same position of this probe, and I'm just going to very simply turn.
So notice how he
90
uses
degrees.
his left hand while keeping the probe in the same place with his right hand. So that's a great way when you're first learning to rotate the probe like he did.
Exactly. And so you can see I did move a little bit because there's a little bit of rib shadowing on that view. So again, I'm going to do the same thing. I'm just going to slide up or down a little bit to try to get that rib shadow out of the way. Hopefully not make it too much worse. That's okay. Let's see if we can get it a little bit better. Maybe here or so is kind of reasonable. Still a little bit of rib shadowing, but we can see for the most part what we're interested in here. So we're kind of down. We're now cutting the heart in the short axis, as I said. We're below the level of the valve, so we're just looking at the left ventricle here, the right ventricle here. The left ventricle obviously is a very circular structure here. The right ventricle is this kind of crescent-shaped thing that hugs around the left ventricle. And all that I need to do from here, since this is a good view to look at multiple things, you can see effusions from here. You can look at wall motion, but I can also look at the mitral valve and the aortic valve just by very simply scanning up and down the heart. So all I'm going to do, if I want to get towards the apex of the heart further down, then we know the apex is further down here. So I keep the same position of the probe, but now I'm just manipulating the tail. So I'm going to tilt it if I want to get to the apex this way to get closer towards the apex of the heart, and I can get all the way out to the very tip of the heart.
So that's tilting or fanning.
Yeah, exactly. And then if I want to, I can tilt or fan back up towards the mid portion of the left ventricle and right ventricle.
So here in the mid, at the mid-papillary level, which we had seen previously, go back down, mid-papillary level, the interventricular septum is muscular, and so you get a good sense of the function and wall motion if that's necessary for you. And then he's going to keep going up to the mitral valve. So that's the fish mouth view of the mitral valve that we had seen, looking for mitral valve pathology.
Keep going up. Let's see if we can. Sometimes you might have to slide up a rib space.
So you can see coming into the middle of the view is the Mercedes-Benz sign of the aortic valve. So this is the parasternal long again, but just tilted or fanned more towards the base of the heart.
Exactly, and then there are some other, I'm going to try to fix this a little bit just because